Hello and welcome. I'm Dr. Jamie Kunkle, joined again with Dr. Janell Payne. We are, as of now, confronting the complex, and we're going to talk more in our part two series here of naturopathic medicine, naturopathic philosophy, how this comes into play and how it serves complex chronic illness patients, how it works well in our practice, and how appreciative we are of those foundations in our learning process. So. We're going to go through, probably pick up where we left off. We're going to go through something called the therapeutic order. It's kind of the order of how we consider interventional therapies, on the low end being more maybe lifestyle, health, wellness, sleep, diet, stuff like this, spiritual health. And then on the high end of things being more surgery, drugs, uh, more procedural interventions that are sort of forcing change within the system in a short time period. And so we'll walk through how vast that range actually is and how we're thinking about that from each person. But we have to also acknowledge that some of our patients, depending on when they come in and see us, they may be a little more dysregulated than a typical health, wellness, prevention, primary care situation. And so occasionally we have to use higher interventional therapies to stabilize people and work our way backwards in the order. So the order isn't linear, doesn't go in one direction. It might go in zigzags depending on where they are. So without
Usually.
further ado, we'll dive in. But Janelle, do you have any thoughts for introductions here?
I just want to say that I'm really excited about yesterday. I feel like this comes at a really opportune time
Mm.
after RFK's confirmation yesterday. And I
Oh
know
yeah,
we'll
that's
talk
right.
about that a little bit
Hmm.
more, but like just these talking about the naturopathic principles like we did last time we met and talking about the determinants for health and the therapeutic order. I think that this is all perfect timing. And so
Yeah.
I'm really excited. I mean, it couldn't have landed on a better timing, I think, as far as
Yeah, and
like what
happy Valentine's Day. It's
happy
2/14 also.
Valentine's.
Yeah.
I had a friend text me this morning and she said happy VD Day. And I was like,
Oh man.
oh,
Yeah,
it was
happy VD Day.
yeah. It
That's
was
why I
it
don't
was
like
meant to be a
acronyms.
joke. It was
I
an
have no
intended
idea.
joke. She said she put those on cookies in grade school and she never lived it down, you
Yeah.
know.
Well, when people say TBI, I always think traumatic brain injury, but it could be tick-borne infection too. So, who knows?
Same.
TBD, to be determined, tick-borne disease. I don't know. I can't
Yes,
keep up with all the acronyms.
all the
But yeah,
above.
RFK's confirmation, highly controversial, but an opportunity nonetheless to see some change in medicine, to see some change in how the environment is influencing chronic illness. So I know we don't probably all, like him the same, and I totally understand that, honestly. I don't like a lot of politicians, I have to admit, in terms of, are
Right.
they really like the ideal people for the jobs that we need to see change? But, it's the way our system works. And I've said it before, sometimes you have to change the system from within the system, and you have to be a system person to change the system. And then in this
He's
case,
definitely a
he's a
system
little bit
person.
less of a system person, although he does have a system name, doesn't he? Being a
Yeah.
Kennedy. Uh, would a guy without the name Kennedy be able to get to that position of power in the same way, or would it have
Right.
taken a lot more? Would it have taken a lot, anyway. So I think in the Lyme world, especially, there are folks mobilizing. I've already seen some leaders in the field getting ready to talk to the new administration and trying to enact change through science, through research, through what we understand
Right.
out there and what
And
we've seen in the field.
it's
Yeah.
really important to note that a lot of these leaders that want to work with our current administration are crossing the aisle. Like
Yeah.
they're not conservatives by
No, they're
nature.
not. I haven't
They're
met very
progressive
many.
Democrats
Yeah.
that are, which I hate to even bring up, the Democrat Republican issue right now. But these are people that are just like, let's embrace the change. Like this might be a time that we can use this opportunity over the next 4 years to get RFK to bring some awareness to chronic illness as we see it. And it's just these people are crossing that. They don't care. They don't. These
Yeah.
doctors are like, look, we need help. From
Yeah.
a
So all those out there listening, I mean, just try to do your part in whatever way that makes sense. If it means if you're a researcher and you're trying to publish stuff, do that. If
yeah.
you're starting a podcast, talk about it. I don't know. I mean, there's just so many different ways we can start getting these conversations elevated a little bit. I think that's why in our first podcast, I was saying I do have hope here because I think we're in an era where we do have an opportunity, and who knows what the next 4 years will bring, and who knows what the next administration after that is going to be. But the fact is, this is a opportunity for us to have these very difficult conversations and discussions, and we do have leaders out there that I trust and respect that are going to be working very hard to get that done. So I hope that provides some hope for some of the doubters out there. But I totally understand. It's uncertain. I get it. That's
Yeah.
that's that's
And I think RFK has had a fairly unpleasant smear campaign, for through the last few months, years.
mhm.
Um, it, I have familiarity as you do with RFK from a long time ago. So I feel like he's been well respected in my eyes for a long time, right? So I
Mhm.
feel like if you're kind of new to RFK, if you just learned about him in the past couple of years when he started running
Yeah.
for the
Or the
for
past couple
president.
months. Yeah.
And then for sure the past couple months, if you're new to RFK, I would say you got to give him a break because there was a pretty tremendous smear campaign, and
Yeah.
maybe some of it's true. But the main points that they're trying to smear him are really like points that I would find discreditable. So yeah,
Exactly. Yeah, I mean, at the end of the day, I mean, this is going to be a dude that's going to actually talk about environmental medicine, and how the environment is affecting our health.
yeah,
And I don't remember the last time we had somebody who was really willing to have that difficult conversation. I mean, when we talk about
right,
the environment, we're always talking about climate change and electric cars. And that's because that's how the lobby sort of works, like there's a lot of money going into technology, green technology, solar panels, electric
yeah,
cars, as mentioned, and other ways to mitigate global warming or whatever we're calling this thing. And but we stop short of really saying, is the environment making us sicker? Why are we having more issues now than we did 10 years ago, 20
right,
years ago, 50 years ago, prior to the Industrial Revolution, whatever? And I don't know. I would just say if there was a person better for the job that would really step up to the plate and do that, then great. But this
yeah.
is what we have right now. And I'm quite excited to see changes to our environment because that affects me, that affects my patients, that affects my children and their
Right.
children.
And we're going to
And
have a podcast. I mean, you and I in our lineup of podcasts, we've talked about like these endocrine disruptors and their role on our
oh, yeah.
hormones, and
Hmm.
HPA axis, and we're going to delve into that in detail in a future
Absolutely.
podcast.
Yeah.
But like all this stuff, it just plays on each other, which of course we all know that. But
Yeah, more to come though, because
more to
I mean
come.
we're going to dive a lot deeper into this, and we may even do a segment specifically on RK stuff. We'll see kind of where it comes, but definitely in the environment, it's coming. It's our hot topics to come.
And I think we should try to get RFK on the podcast.
Ha, we probably could.
He might
Or
be a
we
little
know
busy.
somebody that knows somebody.
Know
Um,
somebody? I know somebody who knows somebody. So,
yeah,
and
it's
I
like
know
two
you
degrees
know.
of separation.
We
Yeah,
we know people who know people. So
yeah,
or even Del Bigtree, or somebody that could speak
yeah,
on this. He might
yeah.
be a
No,
little.
totally. I would love that. That would be great. So
Yeah.
let's dive in. So we're going to talk about naturopathic stuff. So this is part two. So we talked about the principles of naturopathic medicine last time. We kind of each gave our own opinions and experiences in each of these arenas. And now I'm going to talk about something called the therapeutic order because I think it's important to understand generally sort of where we're coming from and how we're maybe evaluating cases and why, we oftentimes emphasize so much of the foundations of health. It's just like I said, that diet, lifestyle, different things like this. So I'm going to go through these one by one. There are about seven of these to discuss, but they're not all super in depth or take a long time to discuss. So the first one is remove the obstacles to health. So health is the natural state of one's body. So they talk about homeostasis, the body's ability to retain balance despite obstacles, despite adversities at any given time. And we really have to appreciate our bodies. Wake up and thank your body every day for what it's able to do, what it's capable of.
Right.
So the first step in returning to health is to remove the entities that disturb health, such as diet, poor diet, standard American diet, all that kind of stuff. Digestive disturbances, inappropriate chronic stress levels. That sounds That sounds like something we're all dealing with right now, isn't it?
Right.
Uh, Individual disharmonies, trauma, probably other things like this. It goes deep there too. So NDs, naturopathic doctors usually create a regimen based on the individual person's obstacles to healing to try to remove some of those obstructive forces, remove those roadblocks, and improve the terrain of the individual. So the terrain was maybe one reason, the terrain disruption is one reason why dis-ease may develop. So we're trying to remove those. So, Janelle, how do you how do you think about this first principle here, this first order item?
It's huge. And it's
Yeah.
so and insurmountable sometimes. Like, and when I say insurmountable, like when I first meet with a patient and we're trying to like talk about obstacles for health, I know that everything that I bring up is going to be a process. Like,
Mhm.
right? Like aside from food, right? Like you get some patients when I say maybe you should focus on these food groups, blah, 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 kind of have a general diet plan for them. And some people will just embrace that. They go through their whole pantry and they throw out everything that has a food dye or sugar or what, right? And so some people can really do that. I would say that's one area that you can probably delve into a little quicker than some of the others. But like if you're in toxic relationships, if you have chronic stress, you're in a job that's really stressful, you can't exercise because you're too fatigued. You know what I'm saying? Like everything outside of that, I see as a big, long process, right? And so it's
Yeah.
hard. Sometimes it feels, I shouldn't say it is insurmountable. I was incorrect in that. It feels insurmountable sometimes.
It can, and some of these things don't just happen overnight too. I mean, sometimes the solution isn't as simple as throwing out your food and changing your job. The shift in
Right.
terrain that happens in individuals can start very early and develop over a long period of time. I mean, if you talk about, like I mentioned, trauma, for example, how that may affect the nervous system and even neurodevelopment in some cases, and how that may change the quote unquote default programming of the brain, how the brain responds to certain situations, stimuli, stressful events, and other things like that. Breaking an adapted cycle in an individual is not, very quick and easy sometimes. And
Right.
with the foods and stuff too, I mean, all that stuff ends up influencing the microbiome in the gut, which is a terrain thing. The microbiome are very complicated and play a very large role in our health and wellness, our normal metabolism of almost everything we can imagine between nutrients and hormones and everything in between.
Right.
So, so yeah, I'm always cautioning people too. I was like, okay, well, yeah, we're going to change the diet up, but there's still a little bit of ways to go in terms of really fixing the terrain over time. Same thing with if you're working on the mental health plane or otherwise. So yeah, so it's kind of in some ways a simple concept with a long-term
Right.
process to answer. And that being said, though, you remove some of those big obstructive forces. Somebody used to tell me. It's kind of like if you had a bunch of, imagine the obstructions or forks or something sticking into your body and impeding normal process. So if you can find some big forks, y- yank them out. Maybe it's working that
Very
much better.
interesting analogy. Forks.
Forks.
I've heard of thorns, pins,
Yeah, I
something,
know. I
but
always wondered why forks. Maybe it's
that's a good
something to
one.
do with food.
Yeah. I can say that like as far as like that obstacle to cure, it's interesting because you're right. If you find just the right thing, sometimes we make some general recommendations hoping that something sticks. I had a rash for 2 years, right? When I was pretty sick. And this is back in like 2009, 2010. A rash so bad all over my whole body that when I would scratch, I would bleed, right? Because it was like
Oh,
it was an insatiable rash. It was like it was awful, like torment, right? And somebody, when I first started school, right? And one of the doctors pulled me aside and she was like, Janelle, you know all the negative effects of gluten, yet you're not gluten free. And I was like, huh, yeah, I guess I kind of do know this, in my brain, yet that's a huge lifestyle. I had 3 kids, being gluten free is not easy, not inexpensive. And I went gluten free. 2 weeks later, I was rash free. 2 weeks later, like shocking, made a huge difference, right?
that's a
Now
big
that's not
fork. It's a big fork.
big fork,
Big
big
fork.
pitchfork.
Gluten. Pitchfork.
Pitchfork.
Sometimes it is
And
a pitchfork. Yeah.
yeah, and I was gluten free for probably 5 years, and I've slowly been able to reintroduce gluten. Now, some might say, how dumb is that, right? Because if it was that inflammatory for me then, it's probably still inflammatory for me now. I'm just not recognizing it with these more obvious symptoms. Anyway,
Well,
more on that.
as the terrain shifts, sometimes the size of the fork may reduce a little bit. I suppose
Right,
maybe the same idea is if you took out a bunch of little baby forks,
right.
that big fork wouldn't seem quite as annoying.
Yeah. Yeah. So
You know.
you're absolutely right. If you find the right thing, it can really shift things. And it was, yeah, genuinely life changing.
Yeah, no, thank you for sharing. And I think that that's a really important point, and that is why we're always kind of thinking from there. So even if somebody comes in with major crisis mode, you still have to review all that stuff because it may be that, hey, yeah, have you been like eating an absurd amount of gluten? Have you been overstressing yourself for this reason or that reason? Or maybe even just validation of their illness because they've been, gaslit or whatever through medicine quite a bit, and
Yeah.
finally they're seen. Sometimes those things really create a momentous shift in normal homeostasis balance in the body, which is really cool. So that I love that. I love that one. That's a good one. So we're gonna move on to number two. Number two says stimulate the self-healing mechanisms. I almost said systems. Stimulate the self-healing mechanisms.
Hmm.
NDs use therapies to stimulate and strengthen the body's innate self-healing and curative abilities. These therapies include modalities such as clinical nutrition, botanical medicine, constitutional hydrotherapy, homeopathy, and acupuncture. So, how do you stimulate the self-healing system? So, we talked about the principle of the healing power of nature, the vis medicatrix naturae. I think this used to say stimulate the vis medicatrix naturae or something like that. Um, but that was probably a mouthful. Um, what do you think of this principle here in terms of how do you think some of these therapeutics, or what therapeutics do you really like to use that are stimulating the self-healing system?
Mm, that's a great question. This is actually one I'm going to turn right back around on you, though, because I feel like this is your jam. So just be ready for that. I'm going to turn this around.
That's fine.
Um,
Well,
I would say for myself to stimulate the body is through exercise. I
yes,
feel like it's
exercise.
life changing to get
Hmm.
the body back in. And I can talk about that later, like if it comes up naturally. But again, it's a personal story, and it's a story that I've seen patients walk through, over and over. And you know,
Yeah.
it's a touchy subject because exercise is hard for patients, especially in chronic illness, and I can attest to that. Um, yeah,
Yeah, no, I agree. And if you can get a person to a point where they can tolerate exercise, like some of the chronic fatigue, ME, myalgic encephalomyelitis world isn't good at
yeah,
doing that in post-COVID. But when they're able to do that, it can be a big game changer. And the right amount of exercise is really stimulating, the right kind of stimulating for the system. And then too much is kind of like sort of overshoots and then sort of
it's
creates,
detrimental, right?
yeah, detrimental effect. But it's a really good one, and I think that's important. Like you can stimulate that through, yeah, movement, through being outside in nature, even for people, like not just being in
Right,
front of the computer all the time. Our bodies really respond to that in a lot of ways. Water therapies were mentioned, of course. A lot of people were even starting to use cold showers for post COVID or whatever,
right.
contrast hydrotherapy, hot cold, hot cold. And then of course botanical medicines come in many forms where they're, maybe immune modulating, or maybe they're adaptogenic is what they call them, where they're helping the system regulate better. Maybe the adrenals, or maybe just normal stress, strain, inflammatory responses on the system. It's kind of the war within, or the marathon within, that's always going on. So a lot of these botanicals kind of help to augment and modulate in some ways. And then I'm of course an acupuncturist, if anybody didn't know that. So I did it for really religiously for my first 6 years of practice, and I saw a lot of good stuff there. I saw, and we'll get to structure function later, but I used to do a lot of acupuncture, a lot of craniosacral type therapies and everything. And those really were bolstering the system, really stimulating
Yeah.
these natural systems in a big way. And homeopathy, I can't say I use it extensively. I use some forms of homeopathic arrangement, I guess I should say, or homeopathic-like arrangements, like low-dose immunotherapy, for example, not quite homeopathy. But I've seen some good stuff even with constitutional homeopathy in the right cases. It's not something I can fully say it's my jam in terms of what I use on a regular basis. Yet I've seen some people do incredibly well with it in these types of arenas. And sometimes if you're able to intervene at that level for those people, you can avoid doing a bunch of really toxic stuff. And that's really cool. So I don't knock homeopathy or homeopaths. Like I think, do what you're doing. And if it's working, wonderful. And like anything else, know your limitations, of course, like everybody else. So,
Right.
um, so yeah, I could go on and on, but these are all good. And then of course nutrients. I mean, I'm a big proponent of mushrooms and mushroom therapies. I love them, and if somebody can tolerate mushrooms, they're a good way to stimulate the immune system and get the natural killer cell function working, and all kinds of really fun stuff. So yeah, and there's other cool things they can do too, which I'll talk about later. So
I'm really glad you mentioned that if somebody can tolerate mushrooms,
I
because
know
mushrooms are like a huge thing right now,
they are.
uh, like they're big business, from everything from medicinal mushrooms to, the all kinds of therapies, right? Uh, I would say like I have a handful of patients, a big handful, many hymns of patients that can't tolerate them because for whatever reason, and I don't know if that's a history of yeast, a history of mold infection, like there's just some crossover, right?
Yeah,
So I think it's really important as the mushroom, and I don't want to call it a fad because I think it is here to stay. It's not a fad. I think it can be, there's a lot of healing properties in them, but it's
absolutely.
important for patients to note that that might not be a healing crisis, you know?
Yeah, and there are specialized mushroom extracts that they're also making out there, and maybe that'll solve some of those problems. Who knows if it's
Yeah.
derived from versus not exactly it. Like AHCC, for example, a proprietary extract from certain mushrooms to enhance immune system function, and then even yeah, they're starting to even extract like psilocybin like synthetically or something like that. So
Oh,
and they're also trying to
interesting.
make some tweaks to it so it's not quite so psychedelic. There's all kinds of
Yeah.
things they're doing with mushroom derivations, and even reishi's flavonoids can be extracted in a really unique sort of way, and maybe that would be more tolerable. You never know. Mushroom
Right.
derived.
Mushroom derived. Yes.
But then we
Yeah, yeah.
start to get a little bit more into pharma, I suppose. But we'll be careful there. But
Right.
number three, strengthen weakened systems. So we talked about removing obstacles from the systems that are probably weakening the systems, so to speak. But this is talking about actually strengthening those systems that are being influenced by those obstacles. So it says systems that need repair are addressed at this level of healing. Naturopathic doctors have an arsenal of therapeutics available to enhance specific tissues, organs, or systems, including lifestyle interventions, dietary modifications, botanical medicine, orthomolecular medicine, such as vitamins, amino acids, minerals, and homeopathy. So, what's the difference between strengthening the weakened systems and stimulating the self healing systems? That's the question. I think I'll let you answer in a moment too, but I just will say very briefly it has to do with what you're using. I think, first of all, like I had mentioned how some herbs are kind of more adaptogenic and modulating and kind of more chill to the system and trying to get the natural functions to work better. And then some of those herbs or even nutrients might be a little bit more on the pharmacologic level. They might be a little bit more on the, we're gonna come in and change the biochemistry a little bit. We're gonna come in and actually create, honestly, a little bit of a pharmacologic influence. And you can do that with dietary modifications too. What if you put somebody on a ketogenic diet, like keto adaptation? Suddenly you're changing the metabolism completely for somebody.
Right.
That's a pretty big intervention. So I just wanted to say my opinion on this is when you're strengthening weakened systems in this case, you might be using stuff that's a little bit more, has a little more oomph, to it. Now, we're going to come down later to number five, and it says use natural substances to restore and regenerate. So, yeah, we'll make sure that we're very clear if we
I
can
don't
be.
know. I don't know if I can be clear. I feel like these are all blurred, right? And then when
Yeah,
you're
they
talking about
kind
an
of are
herb,
in
it's like
some ways.
this
Yeah.
is going to take this out and help this, and this is going to make this system be a little more enhanced. And, like I feel like the lines get blurred there big time.
Yeah, I mean they kind of do. I'd have to say this has been an issue with naturopathic medicine I've seen too, is that I think there was a time where I don't know, maybe these things made a little more sense when we were speaking in sort of the realm of kind of more of a, I don't know how to say, like maybe therapeutics, like a spectrum of therapeutics. So we have our herbs that stimulate the healing systems. We have our herbs that tonify or strengthen the systems. I think tonify was a word they used to use, and they just
Yeah.
changed that word. And then we have the things that what they call restore and regenerate. And I think those are probably uh, a little more that those ones are closer to pharmacology. They're naturally derived substances, but they're more powerful. They're more maybe suppressive or changing in some way. Um, and so, unfortunately, the language has really changed over the years too. So, as I'm reading this from this particular website, I'm remembering different language that I learned before. And this is why we're talking through this because I think, um, it's good for us sort of real time, put us on the spot here to make sense of it in our own world because we
Right.
all know these things and we have these principles, but there's been a lot of yeah, change in the language to try to make it more accessible, but I don't know that it's completely served our field. It's made
Right.
sometimes the way in which we approach things look a lot more confusing and a lot more like, archaic, old school, I guess. And I don't know if that's really been serving our world. So you have to understand that even though we come from this, we've all sort of adapted because that's what humans do, and that's what we do. So anyway, coming on back, just putting it aside there. Uh, what I was talking about was the strengthening of the weakened systems. So, system-based therapies. So, if you're going to say, hey, my cardiovascular system is really not doing so well, I'm going to give you herbs that support your cardiovascular system, or I'm going to give you nutrients like CoQ10 or something that are going to support your heart better. So you're kind of getting a little more specific when you're doing that versus the second one there that stimulates the self-healing mechanisms is really kind of more general or broad modalities in modulation,
But if we
stimulating the
use
body.
that, if we use that same analogy that you just had with CoQ10,
Yeah,
right? Like, yeah, it's strengthening the heart, helps the heart because the heart has 5,000 times the mitochondria, right?
right.
Than any other skeletal muscle in the body, right? So it like CoQ10 is needed for that muscle, and it's incredibly helpful to the heart, and it can help strengthen that. And at the same time, it also provokes the vis, right?
Yes,
The and helping with the electron transport chain, like that
right.
whole mitochondrial function. And so CoQ10 crosses, like that's what I'm saying. It's
And
so
if you're
hard.
doing 1,000 milligrams of CoQ10 a day, is that not like a pharmacologic application of CoQ10?
Yeah, yeah.
It's safe, but it's like you're hitting it like a pharmaceutical then, aren't you?
Right. You're hitting it like
Yeah.
a pharmaceutical. Now you're enhancing immune function. Now you're, you know, pushing the body and you're supporting the heart. So you're doing all of it. And that's why I think that these get really
Yeah.
difficult.
They do. And I think that's kind of the point of us sort of discussing this real time the way we are, because you have to understand that like we're trying to convey where some of the value lies in our training, but we're also sort of like real time saying that like, yeah, sometimes the language of what we do is not as accessible to the layperson as we'd like it to be. And so we've all learned that through time, through just being out here in the world. And so we've taken the good parts of it that make sense to us, and the other parts we've maybe sort of, uh,
Swept under the rug.
yeah,
Right. We just
perhaps.
kind of don't talk about it, right? Because if
Yeah,
it's confusing
maybe
to us.
I'm missing some of the points, but like I'm just telling you real time as like a average, run of the mill working ND here, who hasn't been in school for 12 years. These things still aren't completely, clear to me.
Right. agree. We're gonna get some comments down there
Oh,
to
people are going to
clarify
be a little
things.
bit upset. They're going to be like, you just don't know your naturopathic principles, do you? And I was like, no, we
Right.
went over the principles last time. Those make sense. It's the
Those make
therapeutic
sense.
order
This is
that
where
it doesn't
things
make
get
perfect
fuzzy.
sense. And this is a trademark too. So somebody trademarked the therapeutic order. You know that?
I did not know that.
Um, no, I
Of
know.
course they did.
I better be careful.
Trash in their trademark.
Don't be trashing the therapeutic order. Okay, let's
You're
go to the
gonna get in
next one. I love
trouble.
the next one because the next one is super cool. Um, it says correct structural integrity.
Mm,
Physical modalities such as spinal manipulation, massage therapy, craniosacral therapy are used to improve and maintain skeletal and muscular, wow, that's not worded right. Muscular integrity. It says musculature integrity, whatever. I guess that would work. Structural integrity, see, this is where I might disagree too. I actually think that that could actually be considered somewhere on the lower end of the order, depending
for
on
sure.
it depends on what degree that your intervention is on. Like for example, if you're doing a Rackham Crackham chiropractic, that's probably a little higher on the order, right? But if you're doing some like myofascial work, some craniosacral, if you're doing some basic PT with somebody where you're teaching them how to stretch, how to exercise, like you said correctly, hmm, that doesn't really sound so forceful, does it? That sounds actually pretty chill.
It
And
seems on the most basic level of,
yeah,
you know,
and
wellness. Yeah.
I work with a dude who does osteopathic manipulation therapy. His name's Ramesh. He's super cool. Maybe I'll have him on here sometime. He's a very
Right.
articulate dude, but he talks about structure function all the time and how structure dysfunction in structure starts very early in our lives. It starts with our development in utero oftentimes, and then sometimes birth traumas and different things. And then those are things that accumulate. So they're really part of the terrain issues, like I mentioned, over the course of our lives. So if we fall off a horse at age 10, we get in a car accident, are in a sport that's high contact and stuff like that. Or we have dental care, like braces, for example.
Yeah.
All these different
Huge.
things play a role in our structural integrity. And so that can affect how our vascular system works, how our nervous system works, how our lymphatic systems, our drainage systems work in our body. And at a very fundamental level, if those things are off, uh, that's a big fork sometimes, like that's something that people have to compensate around. And they might be really good at it for a while in their lives until they get some other insult. But I really largely consider structure function a really foundational idea.
It's
It's how you
absolutely,
go about it
yeah, I
that gets
agree.
higher.
And it's important to note that, like, I know you mentioned that, like, the rack 'em crack 'em, like
Yeah.
there was a time when I could tolerate that, but not a massage, right?
Right.
Because the massage might release too many biotoxins, or
Yeah, good point.
right.
Good
Right. And
point.
so, but then the flip side, some patients, you do a typical adjustment of your cervical vertebra and it might light up their nervous system, right? Can create a whole host of problems. So it just depends for each person where that structural imbalance lies on the therapeutic order. And
Yeah.
that's what makes the therapeutic order really challenging, right?
Right. See, it's so individual. I don't think you can even really it's harder to speak about it in generalities. I think the way
Right.
I think about the therapeutic order is really what the individual needs are and then what force of intervention I'd be putting upon them and what were the risks of that particular intervention. I think that if like a drug has a lot of side effects or something, like an
Right.
aggressive massage or an aggressive chiropractic adjustment or something like that could have consequences versus if I'm doing something very gentle and very directed with them, I don't consider that like a high force intervention most of the time, or if it's something that's appropriate for their particular, constitution or at the time of their particular journey. Like for example, yeah, a lot of Lyme patients don't always do well with, say, massages if they're mobilizing a lot of stuff within the system. But maybe they're okay with craniosacral, maybe they're okay with a little bit of acupuncture or something like that. So those are all physical therapies. And then sometimes those things are too much too. So you have to go way back. Like if the ailments in your head don't work on your head, work on the feet or something like that.
Right.
And
And I
then
think what you mean by in your head, that it's not that you have a psychiatric.
no, 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 no. I meant the like your symptoms are literally in your head. Like I have a
Right.
headache and brain
Headache,
fog and all that. My neck hurts.
TBI. Yeah.
That stuff. Yeah, yeah.
Yeah.
Like maybe don't work in the head right away. Maybe that's too high of an intervention, for example.
Right.
So I think I could break down personally, I can break down any intervention, any interventional strategy or any principle here into a therapeutic order of its own. Uh, Kind of how aggressive I'm going to be or how aggressive I'm not going to be, and how that fits for that individual in that point in time. Because some people can handle a lot more than other people, and sometimes the thing that you think is the most benign and the most unlikely to cause a problem for somebody completely dysregulates them. I don't
Right.
know if, yeah, some of you out there and some of you out there who've treated sensitive patients, come on. I mean, like, do you really think there are this many rules to follow? You have to, what works is what works. And
Well,
that's kind of what you have to, so you have to be a little bit humble here too, I guess.
right.
Anyway, I'll move on. So number 5, we're almost done, I swear. Use natural substances to restore and regenerate. See what I mean? Here we are again. So, natural substances to restore and regenerate. So it says here, naturopathic medicine's primary objective is to restore health, not to treat pathology. However, when a specific pathology must be addressed, and NDs employ safe, effective, and natural substances that do not add toxicity or additionally burden the already distressed body. Well, I mean, but everything is technically has a toxicity potential. Like if you're using high dose vitamin therapies, high dose herbal therapies, there's potential toxicity there. Maybe it's a little less toxic, but it depends on the person once again, because my sensitive patients, occasionally they'll do better with pharma with less toxicity potential
Just
than they
gonna
do with
say that.
natural.
I was
Yeah.
just gonna say that. You took the words right out of my mouth, and we didn't even talk about this beforehand.
No, we didn't.
I had to learn this lesson the hard way early on. You know, you have that really, really sensitive patient, that one that walks into your office and man, they react to your presence, right? They just react to everything. And they have a laundry list of, drug reactions and adverse things. Um, and then you think, well, I'm just going to start you out on an herb. I'm going to start you out in like the lowest intervention, right? And following these, I'm just going to super gentle, it's supposed to be nutritive to the body, and it totally flares them. And after working sometimes for months with patients, like trying to like get through this wall of reactivity, I had this epiphany. I was like, let's use like, for instance, in treating Lyme disease, I have a patient in my head and after we just kept, hitting this wall, I said, let's use an antibiotic. Let's just use an
Yeah.
antibiotic. And we did like a month of this particular antibiotic. And she came in and she goes, well, that was life changing,
Yeah.
right? Could not tolerate any of these herbs I'm giving her. And then I do drainage remedies, right? And I'm like, okay, we got to open the system. We got to help with the detox, right? We have to do all these things. And it's stuff that works for some patients, right? And I'm not mocking this, therapeutic order at all. But at the same time, it doesn't work for everybody. And sometimes you just
Right.
got to skip straight to
Yeah.
the higher level. Like I went to the tippy top of the interventional peak, and she was like, wow, okay, that's what I needed. And then we could come back in and she could tolerate the herbs better. Remarkable.
Yeah. And honestly, I think the therapeutic order is really idealistic, I think, at the end of the day. It's kind
Yeah,
of the ideal arrangement. And once again, I think it could be a little archaic because unfortunately now we are dealing with significantly more complexity than we used to in illness. And I think all that environmental stuff is probably playing a partial role in that increased complexity. It's the biggest thing that's changed over the last 100 years or whatever, more than 100 years. And so it is a little idealistic. So, you have to be able and willing to jump the order in certain circumstances and understand sort of what that individual's needs are. But really, at the end of the day, the idea of the therapeutic order is that there's time and a place for everything.
absolutely.
And I like that part of it. I think that's the part of it I really respect is that this is an ideal arrangement that we don't want to forget about all those foundations of health and everything. We don't want to forget that we sometimes don't need a hammer. Okay.
Right.
So don't always jump to a hammer. That's
Right.
really what it comes down to.
I agree.
But occasionally a hammer is what's needed. And so you may have to really start with the hammer and then kind of work your way back. But once you know sort of what that spectrum looks like, it's much easier, I think, to know when, where, how. And some of it is just through experience and I hate to say it, but there's a certain level of intuition with this stuff too when you're seeing patterns in people where you're like, I'm pretty sure that's probably not going to work. I would really love to think that the herbs, for example, are going to be good for this person. But I've seen people flare off of 2 drops of an herb, 2 drops. 2 drops
Right.
set them back
Oh yeah.
for months, you
I've
know?
seen I've seen patients flare. You put a drop in a glass of water and they sip it and they
Yes,
flare. Right?
right.
It's just like I'm like, whoa, it's too
Yeah.
much. Um, yeah. And to speak on that idealism, it's important to note that at the time that this therapeutic order was likely established, I don't know. Do you know the timeline when somebody established this therapeutic order?
That's a good question. I was looking that up. I will have to
That's fine. I
yeah.
totally put you on the spot with that question. But it was likely that naturopathic doctors, chiropractors, people in the tend to, I will say that likely all professions in the health, all healthcare providers use some level of the therapeutic order, right?
Oh
I mean,
yeah,
I'm sure that
definitely.
some version of that is utilized across the board.
Hmm.
However, I would say for this particular therapeutic order, it was at a time likely that we were limited in what we could use. So, in that idealism of like, we're going to do all the things that are in our scope of practice and then make it seem like the pharmaceutical, the thing that maybe we couldn't have prescribed at the time, or does that make any sense?
Yeah. Well, I mean, I think when a lot of this stuff did start, it probably was around the time that naturopathic medicine was really sort of taking off and establishing itself and defining itself. And it probably was the end of the 19th, early 20th century, whenever pharmaceuticals and drugs and surgeries were, I think, also up and coming and a little more iffy and a little more toxic and a little more difficult. And
Yes.
there was a field of medicine that was really embracing them as sort of the answer. And that was allopathic medicine that sort of became our current medical system. And then there was a counter field known as naturopathic medicine that was really trying to preserve our natural medicines and more of a naturalist approach to medicine that we
Yes.
don't need these things. Most of the time, nature provides what we need. Our body knows what it's doing. Our connection with nature is really important, and natural therapies are going to be way less at odds, more in harmony with the natural flow of things. And that's really, I think, where this comes from at the end of the day. But now, fast forward 100 years, I think a lot more has come into the story. First of all, we do have a lot more safety data and understanding on pharmaceuticals now than we did in the past. We have a much more safety in surgical intervention than we did in the past. It's not like
Yeah.
some dude doing it in his kitchen or something. I don't know.
Right.
It's like, and so that's where I say it's idealistic a little bit that like in an ideal world, I think we would be more in tune with nature and part of nature and everything. But our system has changed. Our society has changed. We unfortunately aren't as much attuned to nature as we used to be. A lot of things are very artificial, artificial light and, you know, uh, just our worlds that we live in. I mean, you don't have to follow light dark cycles. People work night shifts. It's just it's not there's not a normal ebb and flow that there used to be, I think, at the moment. At least not most people. So in that case, we're kind of dealing with a little more of an advanced issue. And I think
Agreed.
that's where it's not so quite so black and white nowadays. But I understand why people want to hold on to that because it is important to consider the possibility that we can reach a world again where we're a little more in harmony with nature. I mean, why do you think I'm personally excited about somebody coming in and talking about environmental medicine? Well, it's because it has played a big role, and the more we can clean up our food and some of these really basic things, it's one step closer to that. So anyway, that's
Yeah.
just an aside. So anyway, so we have 2 more, but they're probably easy to talk about. One is using pharmacologic substances to halt progressive pathology. So a lot of NDs don't really like to do pharmacy too much because they say it's too suppressive, too much suppression. So halting progressive pathology. NDs are trained in pharmacology and how to use pharmaceutical drugs when necessary. If their state license permits, they can prescribe these agents themselves, or if not, refer to a conventional medical colleague. Yeah, so we all learn how to use drugs, but most of the states in this country don't allow us to actually, prescribe them. But that's beside the point. Um, but we're probably some of the most careful people with drugs, most of us anyway. I would have to say, because they're something we understand, but we have so many other tools to try to consider before using them. But then as we start to find that they're necessary in practice, we do our due diligence. Most of us do our due diligence to understand the safety, the interactions with other therapies, including herb drug interactions and stuff like that. So I actually want to say that we do a pretty decent job with pharmacy whenever we personally feel connected to it or using it regularly in our practice. Most NDs I've met are pretty good with pharma, I have to say.
Yeah, I agree.
Yeah. So
The
we
ones
all
that,
our
that don't really
opinions.
like pharma, they tend to not prescribe a lot. I mean, just because they're not as comfortable with it. And the ones that do like pharma take it a little bit more vested interest in
Yeah,
learning.
totally. I
I,
mean, I think that mostly NDs and pharma, NDs think more mechanistically with pharma, and I'm not saying that other practitioners don't, but we're always trying to figure out what is the mechanism of this? How is this actually working? How is this affecting the physiology or the biochemistry or the biology of the person? How is this affecting the infection? How is this inhibiting the infection? How is this creating a static effect or whatever? How's this affecting biofilms or something? Like we're thinking about all that at a pretty deep level, I think, most of us. And I'm not saying other conventional practitioners aren't, but when you've worked in complex chronic illness, wherever walk of life you come from, you're probably considering pharma. And even functional psychiatrists I've met, they're not just like, here's an SSRI, like a recipe. They're like, no, this one might help, neuroinflammation or something, or this one may help glutamate pathways or whatever. So anyway, I just wanted to put a plug there that pharma can
I
be
agree.
looked at a little different.
It can be looked at a little different. And I just, sometimes I want to push back a little bit on the don't suppress symptoms. I'm a huge suppressor of symptoms. When patients come to us, they are so sick.
Right.
If we can suppress a symptom to where they can just feel an ounce, of hope, like sometimes that's okay. But I'm pretty clear, like I'm giving this to you to suppress symptoms. It's not really taking care of the problem. It's
Yeah,
just making it more tolerable as we take care of the problem. And
exactly.
I think that's important. I remember in school, like they really hammered on us about like, don't suppress symptoms and how awful that was. And I just disagree.
Yeah, I mean, I think the way I see it is you don't stop there. I think that's the
You
biggest
don't stop
difference.
there,
I
right?
think that some people are so bogged down on the suppression principle, like don't ever suppress, that they don't realize that, well, okay, so in some medical systems, people stop at suppression because that's what they have in their tool bag and that's what they give people. So here's your statin for the rest of your life. Here's your blood pressure med or your antidepressant forever. And I'm not,
Exactly.
you know, obviously, if you're on it for the rest of your life, they're not really doing very much beyond that to try to improve the situation. Usually, they might be like, "Oh yeah, go clean up your diet." Okay, but what am I going to do?
Right.
So I think that for us, whenever we use pharma, usually we're thinking of the long game to hopefully not have to use pharma. And if we can reach that and achieve that, that's really the ideal. And that maybe is the ideal too. And some people maybe do need to be on some form of pharma. And but we're always thinking there's a world and a possibility where they certainly do not, and that we're going to use our other therapeutics, our other interventional strategies, and our other things to try to assure that they don't need to be on them forever. Yeah.
Yeah, I agree.
Okay. Last one is high force invasive modalities, surgery, radiation, chemotherapy. When life, limb, or function must be preserved, NDs refer patients to providers. They don't do these things themselves, I guess,
Right.
who are expertly trained in these arenas. At the same time, NDs use complementary or supportive therapies to decrease the side effects and increase the effectiveness of these invasive procedures. Clearly, they're kind of pointing to the cancer oncology world
Yeah.
here. It kind of sounds like because there are a lot of NDs who do work in that field, and I really have a lot of respect for them. It's a different variety of complicated chronic illness, uh, and those folks may how they get to that is a little bit different. Like not all of our patients progress to cancer generally. Like when we have our complex illness patients, they may have a different manifestation of how the environment and how their genetics are interfacing and everything. And so there are certain, my opinion on oncology stuff a little bit is that like if there is a cancer that has really good data and really good information that a chemotherapy or a radiation or a surgical removal is going to going to really prolong that person's life and give them the best outcome, then that makes sense to try to support that. And then there's some situations where it's really not so certain and it's almost anybody's best guess where the oncologist isn't really sure. So they're like, oh, we might throw this at it. And then everybody else isn't sure. Those cases, those people may have alternative paths and they might be able to work in different realms more
Yeah.
effectively. So it's really, I'm not an oncology specialist, but it's not a one size fits all, just like any other area of medicine. So,
This is kind of random, but I want to throw out this name. And do you follow Vinay Prasad? He's an MD,
hmm,
PhD. Um, I follow him on X and Substack. He's just very good. He's out of San Francisco. He has some podcasts. He podcasts quite a bit, actually. He's kind of inspiring to
mm,
listen to. Um,
yeah,
but he's an oncologist, and he talks about that, that very thing. Like, are we doing harm by treating
right,
with, some chemotherapeutics, and or are we doing benefit by the patient? And I totally agree with you. If the data is good, and it's interesting because he breaks down data. That's the reason why, like, he really
yeah,
breaks this down. Like, this is junk data. We're treating
right,
the patient for, uh, anyway, maybe for some alternative reasons. So I find that really fascinating. Sometimes I want to throw some papers at him, on like mistletoe,
right,
for alternative cancer treatment, and just say, can you analyze this and give
right,
me, can you spit this out for me, almost like Chat GPT? Can you
yeah.
please analyze this and give us your take on it? But he's really great. I would recommend his follow.
Yeah, no,
Yeah,
absolutely. I mean, I think it takes a like anything else in chronic illness, it takes a holistic approach, I think, if you can make it happen, an individualized medicine for these people and
yeah,
understanding the goals, uh, their individual goals and respecting those too, and whatever that looks like. And,
yeah,
palliative care model of many different forms of complex illnesses is sort of on an emerging path where can we improve the life that one has, the health span of an individual versus the lifespan of an individual. How can we give them the best life they have with the life that they have, so to speak? And
right.
that means different things to different people. So I think, yeah, so those higher interventional therapies definitely have their place. And I can't say that I haven't referred somebody for surgery. I have in certain circumstances. It
Sure.
really makes a lot of sense. And when it makes a lot of sense, it tends to be helpful. And there's always risks like everything else, but I think
Okay.
any of those higher interventions do have their place. So I do agree with that part of the order. Those things, we've come a long way, like since the emergence of naturopathic medicine, as I mentioned. Those things can be safer. They can have better data to assess risk, and sometimes they do have junk data, and they just push them because of medical paradigm that people are stuck in, like or the tools they have in their tool bag, or like we have chemo, so we might as well throw this at it. It's like, nah, I wish we could get a little bit more away from that into more of an individualized care model in all facets of medicine, rather than just treating the disease. I mean, it's the cliche, as the cliche goes. Don't treat the disease, treat the person. It's like, don't treat the
Right.
infection, treat the person. It's like all those things are very important to remember.
Yeah.
Okay, well, so we completed that part of it. Uh, we can probably spend the rest of the time. Well, I was thinking where we want to be. We talked about the limitations of the therapeutic order already, and sort of maybe the context of where it came from and how it's sort of a best case scenario. in most situations where you can use it as a general guideline, kind of like start here first or think about this first in case management and consideration.
Yeah.
But just knowing that people are going to come at different levels here. They're going to come in different levels of dysregulation, different levels of complexity, different levels of toxicity or issue. And depending on that, you have to pick what works. And you learn what works through experience, through practice, through increasing our understandings, probably, scientifically speaking too, in terms of research and data when that stuff is done correctly. But you have to also acknowledge that you're dealing with an individualized system here. So there are a lot of human things that unite humans together, but there are a lot of you things that need to be considered in these types
Yeah.
of cases. So does that sum it up for you, or what do you
It
think?
sums it up for me. I had a lot of information today on like the determinants of health, which I feel like is just it's an offshoot of this. Maybe
Yeah,
it's
why
a
don't you go ahead, explain
podcast.
some of that? Yeah, explain some of that.
Well, I mean, in determinants of health, I like it's like what are all the foundations that like like that patient that brought in the diagram that you described, like
Oh
this
yeah.
is my spiritual health, this is my physical health, this is my, like really branching off like food, nature, socialization, like all these things. Those are all determinants of health, and all of those really have to be healthy for us to be well balanced. And
Yeah, I wanted to share really quick because we talked about this offline, but yesterday, or no, it was Wednesday, a patient came in with her mother, and her mother had suffered from chronic illness already and kind of understood a lot of the foundations, the holistic model, the individual model of understanding, and all the different systems that could become dysregulated, and how the illness as it's presenting is a summation of a lot of these different pieces. So anyway, she came in with this giant poster board and drew these things out all over, and which included it was representing also objective data there as far as this is what the lab said, or this is what physical examination or something said, and then was also including like neuropsychiatric or the emotional, spiritual, hormonal, biotoxin or toxinal infections, general immune system function dynamics, and all of this. And I'm probably even missing a few. It was just this, it looked like this really, really busy, poster board presentation. And I'd love to share it sometime if I'm given the permission. And it's just as a general concept, this is what we're thinking about all the time.
I
And
was just thinking that that's what my brain looks like. Like when a patient's sitting in front of me, my brain is swirling with their diagram.
yes. And so what I'm realizing is that, and I used to do this, and then as I went more virtual, I still see people in person. I was just seeing people in person this week, but as I went more virtual, I stopped doing this as much. But I used to sit there with all this scrap paper and just draw things for people and show them visually, because I'm a real visual learner too, honestly. And
Same.
I learned in my undergrad how to learn by copying notes or writing in a certain way to integrate that knowledge. And so I still do that. I still do handwritten notes even at conferences and stuff like that. It's a way in which I can learn visually. And so I would love to be able to get that out there a little bit. And I think that's something maybe we could do a future podcast on. I want to use visual cues to convey the ideas that we've already presented here.
Yes.
And I want us to be able to look at it individually and then look at it as a big complex web. And as you start to look at it individually and you reinforce, 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 usually, honestly, because I remember as I was sitting there talking to them, I was like, point to this, point to this, point to this. And I was like, poo, 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 poo. You know, uh, it starts to become clearer, uh, even though it's really complicated, but it starts to make sense. As it starts to make sense, there that's an amazing step. We talked about doctor as teacher, all that kind of thing before. We talked about the importance of education. Knowledge is power. The more I understand, the better I can help people. The more they understand, the better they can help themselves. And it doesn't sound like we're just throwing 8,000 things at you. We're not trying to make you some kind of like guinea pig or something like that. Sometimes we do a lot of things, but we're doing things intentionally, principled, you know, and maybe there's an argument for not doing them all at once. I agree with you, but sometimes we are doing a lot of different pieces of that puzzle.
So I was going to speak to that because I have patients all the time, right? And I said that I try to keep a lot of that in my head, right? And then I'll share as I need to share so I don't overwhelm the patient because, they're easily overwhelmed in the clinic and it's a
Yeah.
long appointment. We talk about a lot. Oftentimes they'll say, well, what about heavy metals? What about mold toxins? What about, and I'm like, well, these three things that I prescribed today address all that as well. Right. And so I really appreciate it sometimes when they bring it up because I'm thinking of that, right? Like, oh, I'm going to add this and it's going to hit all these factors, even though I don't always verbalize that,
Right.
even though sometimes that's overwhelming. And then they kind of feel a little more reassured, like, okay, great. And
Yeah.
there's a lot of like, okay, in due time, like you said, you can't hit all of them at once. But you'll have a patient that comes in. I mean, I've had it happen. They'll come in from other providers and they'll be on 50 supplements.
Hmm.
And I'm like, ooh, you're hitting it all at the same time. Like we just have to clean this up and see like what is helping, you
Right.
know,
Consolidate.
and yeah, consolidate. Anyway,
And the
so
things that you're choosing with that model, you are trying to choose the things that hit more than one thing at once, like you just said. It's like
yeah,
this one substance or this one thing that we're giving you is addressing this, and this, or at least it's supporting aspects of each of those different principles or those different
yes,
areas. And so like that's also why I wanted to convey it visually, or just show it visually, because I wanted people to understand the internal workings of how we sort of choose things. And I think all of us kind of have our own models there, of course, or our own little whatever you want to call it, paradigms of understanding or whatever. But it's important to think about. So anyway, I just wanted to say I do to kind of get close to wrapping up this naturopathic piece. We could probably do more on this later, I'm sure. We could keep talking through it. Um, that's kind of the importance of that foundation of training, though, is it's to me it's uniquely equipped to approach the realm of complex chronic illness and the ever emerging realm of more complicated chronic illness that we're seeing, and the fact that even folks that are a little more on the healthy functional end of the spectrum
yeah,
are emerging too to have a lot of different complicated elements. And so the more you're able to think about this holistic model that we're discussing here, I think the better you're able to meet the moment that we're in terms of what the needs are of medicine and where the changes need to be had in medicine. I do think that this type of medicine is the future, and all of us need to adapt. Like naturopathic medicine needs to adapt, conventional medicine needs to adapt. We all need to adapt to the now. And that's really what the take home message is, where we're coming from, is that we're all trying together real time. And I think Janelle even said in one of the first ones we did, like in 10 months or even 10 years from now, everything that we're saying may be wrong. Some things may be wrong,
maybe not everything we're saying.
not everything.
Hopefully it's just a, hopefully it's
A
just
few
a
details mostly is what I'm trying to
details.
say.
Yes. Yeah, yeah.
Yeah,
No,
a
I
few
agree.
details.
And and you bring up a really interesting point. I know I say that a lot. I'm gonna have to have a different segue there. But just to stem off what you said, that like conventionally they're gonna have to kind of change some of the paradigms. We have to change some of our paradigms, right? And I will say that like I have seen, I interface with a lot of MDs as you do, right?
Mhm.
Nurse practitioners, you name it. Like I cross over into those worlds with a lot of different providers types. And I would say that like universally, they're catching on, right?
Yeah,
Like neurologists are prescribing, skull cap. And I mean, I just find it interesting, cardiologists are giving CoQ10 to their patients. I'm starting to see there's a lot of crossing over of that,
hmm,
and I love it. I actually like
yes,
it. Now, a lot of people don't like the scope creep, right?
right,
They get kind of a little territorial, and I'm sure that can be good and bad. Let us have our thing. We do the supplements, you do the. But
yeah,
I actually find it really affirming, if you will, that validating that
yeah.
yeah, they find that like it's the studies. There's good research on it, and um,
The
yeah, we
truth will prevail.
the
I
truth will
mean,
prevail. And the more we all kind of get on the same page, the better off we will all be, right? I mean, sounds
That's
cliche.
it. I know,
That
I know.
is,
I mean, it's important though, and I think as NDs, it is kind of hard because, like I said, we don't have scope of practice in every state. We have a massive amount of debt, for example. Like there's a lot of things that make our lives a little bit hard already. And then when we see other professions kind of starting to step in and do the stuff that we've been doing for a long time, like we were doing functional medicine before it was called functional medicine, but now it's
right,
functional medicine.
right.
It can kind of trigger some trauma or something for people. I'm not really sure. But it makes it sort of difficult because we're already been trying so hard to legitimize the medicine that we have as good medicine. And so where we're at right now, I mean, it's a little tough being an ND, I have to admit, because, and I'm encouraged for the broader world, though, that more medicine systems are embracing these things. So to me,
Yes.
it's not about me. I can get upset because, like, maybe I should have gone and DO'd or MD'd myself at some point to get the great power that comes with it. With great power comes great responsibility. Um, but I
Or
feel,
or we get, a chance at, being able to make bigger differences rather than feeling more
yeah,
isolated. Hence the reason
that's
why
it.
we're doing a podcast, right?
Exactly. And that's
Because we
why
don't
we're
have
doing this.
opportunity.
Yeah,
We
exactly.
don't.
And that's exactly, I know. And that's why we can do stuff like this though. We can talk, we can educate, we
Yeah.
can get these ideas out there and people will do what they will with them. And some people might be like, oh, those crazy NDs, I don't think what they say is legitimate. But people who are in this have either experienced complex chronic illness or are treating complex chronic illness, no matter where they come from, whether they're a nurse practitioner, an MD, a DO, a herbalist, or somebody else in between, anybody, PT, whatever. Any of those people are going to understand these general concepts because it has become a necessity to understand them, that we're not able to get people better without diving a little bit deeper, you know?
Right.
And so we're just all arriving at different times in different places. That's really what it comes down to. And so I believe we are all arriving there slowly but surely. And
Yeah.
I believe we are going to see a significant amount of change here in the latter part of the Roaring 20s. Started off a little bit
Yeah.
difficult, but I think we're midway through. I feel good about where we're going for the rest of this decade, and we could be
Yeah.
looking at some pretty big systemic changes happening at the medical level. And I think that might bring more people into medicine. We have a really big shortage right now, so we need to get people excited that there is something meaningful happening. There's a movement happening here, and
Right.
so I'm excited that could happen. It
I
could.
just want to reiterate, if somebody missed that out there, what you said, that it is not about us, it is really about the bigger picture. Because you very well stated that yes, things are becoming more acceptable, right? We're starting to see MDs doing what we're doing, DOs doing what we're doing, and vice versa, right? We're doing what they're doing to some degree. And while it may, I don't want to use the word dilute, maybe that's an inappropriate word, it dilute our medicine a little bit or dilute our relevancy.
Mhm.
Um, but at the same time, it's not really about us as much as we want. It's hard. Sometimes it's hard to see because we don't have the job opportunities and the opportunities to make changes,
Right.
outside of our private practice. However, ultimately, the goal is increased access to care. And that is something that we have harped,
Yes.
really
Yes.
emphasized from the beginning. Yeah.
No, it's something we all want to see. It's very important to us because I want, those sick folks out there, those kids, whoever, to have access to this stuff.
Yeah.
I don't want them to be lost, isolated, or fall into the system in some other type of way that's not helpful. That's a life. Each one of those lives is a life. It's an important life, and
Right.
they should be given the same opportunities. So for me, I try to think about it or reframe it into the bigger picture. So I have my own individual struggles and my opinions and my biases and my traumas and my experiences, of course, and I'm going to express them sometime, and I'll try to be as clear as I can about that. But at the
Right.
end of the day, most of why we're doing this and why we're trying to be a part of the conversation, because all of us can do our part in different ways, is really to see that systemic change, to see that societal change, to see that community change, to get that access, to get ourselves healthier than what we have been, to reverse course, to stop the progression of this, to stop complex chronic illness from being so common, you know? I don't want to see that. If that's an occasional patient, there's a lot of reasons, genetics and other things, but we should not be seeing this much of it. That's what it comes down to.
And the devastation. So, like
Yeah.
as you sit with patients, and you just hear their stories, and I know you do, I'm going to try to do better about getting some patient permission to share some salient points of their
Yeah, me
history.
too.
Even though like globally, these patients are so similar to other patients, they have really key features that I wouldn't want to disclose,
Right.
without
Can't give
permission.
identifying information. That's HIPAA.
Identifying information because each case is so unique, right?
I
And
know. It's
yeah,
true.
yeah,
That's okay. No, I think in the future we will get the permission and we will find some ways to not identify. But I
yeah,
think case studies and discussion are incredibly valuable.
for sure.
Almost every time I've brought up like, oh, this one patient, this kind of thing, I think it's been received well in these types of platforms. I really think it's very important for people to hear real stories, the reality.
I do
Because
too.
we could talk ideas all day long, but like
Right.
real people, real ideas, real stories, like, these ideas enacted in real time, like what that looks like, and what is the course of that kind of thing.
And I've reached out to several of my patients and patients outside of my care, which I think is actually really valuable when patients are outside of my care and I ask them,
Mhm.
kind of their healing story, their healing journey. And I've hosted a few podcasts, myself and these patients, just letting them share their story. And it's really interesting. What worked? What didn't work? What was where did you spend the most time that you shouldn't have? And I think those are really valuable. So,
Yeah,
we'll be doing little mini series. I know you and I both talked about that. Like I'll do it some mini series with patients with PANDAS PANS that want to
yes,
speak. I even have some kiddos that have recovered that want to share their story, which is powerful, right? Like
yeah,
wow, from their story. And then, of course, the kind of the parents' view of it as well, kind of
certainly.
going through it because they have different views of the same story, right? As
Exactly.
different
Yeah, no, we'll
perspectives.
be doing more interview style in the future too as this thing takes off.
Yeah.
So yeah, so I think we could probably conclude here for today. This has been wonderful, always a pleasure. And until next time, I'm not sure what our next topic will be quite yet. We have a bunch of thoughts and ideas, but it'll be a surprise. So can't wait though. It'll be very soon. And I wish you all the best and wish everybody, I guess, what
A
do you
happy
wish everybody?
Valentine's Day.
That's it. I
Go
think that's
out,
a good
have a
one.
nice dinner, and yeah, or make a nice dinner, something. Just enjoy the
Yes.
one you're with tonight. Maybe less phone tonight.
That's it. Exactly.
Right?
That's a really good idea. Yeah. Stay off the channels or whatever. Stay off the airwaves.
Yeah, stay off the airwaves and just sit in front of that person and stare at them until
Be
some
present
conversation comes
with your
to.
significant other or somebody you really care about. It doesn't have to be
Yeah,
a boyfriend, girlfriend. It can just be a friend, somebody, your cat. I mean, it doesn't matter. It's like, be
right,
present with a
right.
being that you truly love and care about. And that's
Yeah.
that's that's what I'll leave you with today. Okay.
See
All right. Have a good day.
you later.
Bye-bye.
Thanks. Bye.
Thank you for listening to our podcast, Confronting the Complex with Dr. Janell Payne and Dr. Jamie Kunkle. As a reminder, the views, thoughts, and opinions expressed by Dr. Jamie Kunkle are solely his own and do not reflect the views, policies, or positions of Gordon Medical Associates or its affiliates. Any content, discussions, or advice shared on this podcast are independent of Gordon Medical Associates and should not be interpreted as a representation of Gordon Medical Associates. Gordon Medical Associates does not endorse or take responsibility for any statements or viewpoints expressed in this podcast. Thank you, and I'll see you next time.